The London Women's Clinic has long been at the forefront of IVF developments in the UK. Three of these developments, rapid embryo freezing, extended embryo growth in the laboratory, and improvements in embryo selection, mean we can now introduce at the London Women's Clinic a new mild approach in IVF, which is simpler, safer, and more affordable than traditional IVF treatment. We call this new approach IVF Lite.
Here at London Women's Clinic in Wales, we've been offering the IVF Lite program for the past 4 years. What I wanted was something which is going to be safe and simple, affordable for the patients, but at the same time, as a clinician, the most important thing that I look at is the success rate of treatment. Am I going to be able to get my patient pregnant? If you look at the IVF Lite program, it's only 2 weeks of drugs that the patient is on. It's a shorter period of stimulation. Because of lower dose of drugs that is used, the patient is at the minimum risk of ovarian hyperstimulation syndrome, which is one of the biggest worries even today about IVF. It's affordable for the patient because the lower drugs dosage that is used, it makes the treatment far more cost effective. But taking all that on one side and with a 45 to 50% pregnancy rate, it's a win-win situation for the patient and for the clinic, which is very fulfilling for me as their clinician.
I chose the London Women's Clinic. My surgeon referred me, said it was the best place to do my IVF Lite. IVF Lite is a lot softer treatment, so the drugs are less harsh. The IVF Lite was just a better option for me, and it worked.
My partner and I had been discussing looking into having children, and IVF Lite was the more affordable option because it was lower in cost. Having IVF Lite, the dosage of the drugs was a lot lower, and I was explained by Dr. Thackeray that I may not produce as many eggs, but the focus was on quality and not quantity.
When I was going through my treatment, I was lucky enough to feel really welcome. They'd always make me feel like no question was a bother. I always felt special with all the nurses and all the doctors.
I now have my son, he's 5, and with my final treatment I've had Ava, so I've now got my 2 beautiful children.
When you come to the clinic, they help and support you through it. Dr. Thackeray has been amazing. I felt when Ruby was born, she was the one who created her for me. She's special, special lady.
The starting point for the world's interest in a mild approach to IVF came in a major study from Bart Fauser's group in the Netherlands, which clearly showed that an aggressive approach to IVF was no longer necessary. Professor Fauser is now a consultant IVF specialist here at the London Women's Clinic.
In my opinion, IVF Lite is a good thing, especially from the patient perspective. It's lighter, so there's less burden of treatment. It is simpler. It has been shown to have comparable efficacy with the current standard regimens, but the benefits are quite clear. Fewer drugs, lower cost, less complications. All those things together make it a very attractive alternative. There are several technological developments that made light IVF into a successful treatment. Now you can culture embryos to the blastocyst stage with improved chances for implantation of these embryos. So we transfer only a single embryo, fresh, and thereafter freeze supernumerary embryos to transfer in subsequent cycles.
The key to cumulative cycles depends on a reliable method of embryo freezing. And that's what we have today in the technique of vitrification. Vitrification has given us the most efficient freezing method ever and made possible single embryo transfer and subsequent frozen transfers from the same egg collection.
The most important aspect of mild IVF, I think, is safety. Safety for the woman undergoing the IVF treatment and safety for the child, because mild IVF also relates to the transfer of a single embryo only. We know that multiple pregnancies are associated with more chances for complications. Based on mild stimulation seems enough in the majority of cases to get 1 or 2 good quality blastocysts with a high implantation potential and therefore a good chance of an ongoing pregnancy leading to live birth.
You can have multiple attempts of embryo transfer without having to go through several attempts of egg collection. And that is then reflected in the higher success rates that we are able to achieve for many of our patients. IVF Lite is going to be an extremely welcome development simply because it's going to make the whole technology that much more accessible and affordable.
Contact the London Women's Clinic today to find out more about IVF Lite, a simpler, safer and more affordable IVF treatment.